I now call on Layla Moran, participating virtually, to move.
Thank you, Madam Deputy Speaker. I beg to move the motion in my name on the order paper. And I would like to start by thanking the Backbench Business Committee for giving us time to debate long COVID today. I would also like to thank members of the All-Party Group on Coronavirus, especially the Honourable Member for Central Suffolk and North Ipswich, and the Honourable Member for Denton and Reddish, who co-sponsored today's debate. But most of all, I want to thank everyone who has written to me, the All-Party Group, or their own MP in the last few weeks with their stories. Their accounts are deeply moving. Today's debate is for them. In one such email, a constituent of mine said, "I can't see myself getting better and being able to beat this fatigue." Her experience is sadly not unique. Other symptoms of long COVID include, but aren't limited to, poor memory, brain fog, headaches, lung pain, palpitations, muscle pains, purple toes, hallucinations, hair loss, and insomnia. These symptoms often start weeks or even months after the initial bout of COVID, and many report them getting worse, not better, with time. Long COVID affects young as well as old, and the numbers are staggering. It's believed that there are 300,000 people living with long COVID already in the UK, 7 million worldwide. New research in The Lancet suggests that more than half of people who are hospitalised experience ongoing symptoms 6 months later, and the ONS estimates that 1 in 10 people who contract COVID at all will still have symptoms 3 months later. So far this year, we've consistently seen over 40,000 new coronavirus cases a day, which means potentially there are over 4,000 new long COVID cases a day. I repeat, 4,000 more cases a day. And yet, despite these numbers, public awareness of long COVID is poor. Many who are young and fit think that they have nothing to worry about, that the restrictions are more about protecting others than themselves. But one expert told our group this week that anyone who flouts rules by thinking it won't affect them is also playing Russian roulette with their health. We are concerned that the government's focus on NHS beds being the primary metric by which danger is measured means that the public believe that if they don't end up in hospital, then this counts as a mild case of coronavirus. The problem is a mild case of coronavirus can lead to long COVID. And Madam Deputy Speaker, there is nothing mild about long COVID. Take Jason, for example. He's 23 years old and he's a personal trainer, so not the profile of someone we often see blighted by coronavirus in the news. And he told me, for the last 9 months, I haven't been able to leave my house due to the long effects of COVID. I haven't cooked all my meals for a whole day since the end of February. Every small is a major task, and I can't walk more than 100 meters without suffering. And the evidence of children getting long COVID is building. There are new groups like Long COVID Kids who have been highlighting how children can present very differently from adults. And this needs robust research fast, as there are surely implications for how we view school safety. The consequences of this emerging reality should give us in this place pause for thought. There are some who are arguing for a rapid unlocking when the first wave of vaccination is complete. And yet the effect that such a move will have on the numbers contracting long COVID seems to be missing from the debate. Long COVID is scary, often heartbreaking, and it is avoidable if we prioritise keeping numbers low. So today, the All-Party Group is calling for 3 things: better reporting, urgent money for research, and recognition by employers and the welfare system. On reporting, we need a national register to count and publish the number of people living with long COVID in the UK. Now, positive cases, hospital admissions and deaths due to COVID-19 are published regularly. We need to add long COVID to that list. And doing this would help to drive up compliance, especially in younger adults. But it would also help to explain policy decisions about future rules and restrictions, especially once the most vulnerable have been vaccinated. Many long COVID sufferers have no formal diagnosis, as they never had a test because, well, tests weren't available in that first wave. But it's also worth noting that long COVID can emerge months after a bout of the initial virus and long after the antibodies remain. So even an antibody test may not tell the whole story. So this register needs to be symptom, not test-based. And we also need active follow-up of people who test positive for coronavirus to identify long COVID cases better and offer support. Next, research. Government needs to improve the scope and funding urgently, both into the disease itself, including its prevalence among different sexes, races, and groups, diagnosis, but of course on effective therapies. Clinicians have called for the approach to be truly multidisciplinary, and it should cover mental as well as physical health. There are currently 69 NHS England long COVID centres, which is a good start. However, this is a postcode lottery, and we've heard, for example, that there are none in Wales. And some have reported being turned away when they go, or even told that they aren't treatable. Long COVID's impact on mental health needs further research and support too, and that includes children. And while we welcome the NICE guidelines, we also need to remember that there's a lot that we still don't know, and that those guidelines need to evolve rapidly to reflect the most recent research. Madam Deputy Speaker, long COVID sufferers feel that they are forgotten in this pandemic, and their plight needs recognition by both the state and employers. Take Liz. She told me, "I lost my job as a result of my illness, and I have struggled on universal credit. It doesn't cover my bills, and I'm getting further and further into debt and can't see a way out." Or Alexander, who's a head teacher. "After 23 years of service as a teacher and a head teacher, I now have a written warning on my employment record due to me becoming ill during a global pandemic. I have a second review meeting in just over a week's time, and having not made sufficient recovery to return to work, I will most probably receive a final written warning." Or Daisy, an NHS nurse in Wales. For 4 months, she received reduced and then no pay from NHS Cymru, who told her that they weren't able to support staff who contracted COVID-19. She then had her case resolved, but she continues to say that this hasn't resolved at a national level in Wales. I have to say to the House that this story, and many others like it, have left me speechless. A head teacher, a nurse, key workers on the front line who have no choice but to do their job with inadequate PPE and testing, and now face financial ruin for doing their duty. It is unacceptable, and that's why the APPG recommends that the UK government should recognise long COVID as an occupational disease and institute a long COVID compensation scheme for frontline workers. This scheme should go beyond existing sick pay schemes and should be specific to those living with long COVID who are unable to work. During the first wave, I led a cross-party group of MPs in calling on the Prime Minister to set up a coronavirus compensation scheme for the families of frontline workers who tragically died in the line of duty. And the government listened. And now there is a scheme, albeit for just NHS and social care staff, but it is in place. We need an extension of a scheme like this, so it mirrors the Armed Forces Compensation Scheme, and it recognises that casualties are not just counted by the tragedy of death. And what of everyone else? Well, guidelines from the government for employers is crucial, so that the public and private sectors know how they should be supporting people with long COVID. I first wrote to the Prime Minister recommending employer guidelines in August, and 4 months later, we haven't seen any progress. And last but not least, when all else fails, we need to make sure that our welfare system is not unfairly excluding people with long COVID. Statutory sick pay, PIP, and universal credit all need to be geared up to support them, and indeed their families who suddenly find themselves as their carers. Madam Deputy Speaker, there are so many unanswered questions and concerns, and as you pointed out, not enough time. Our understanding of COVID and long COVID in particular is evolving day by day, and I have no doubt that this will not be the last debate we have on this matter. Reporting, research, and recognition are all desperately needed, but more than anything else, we need to protect our heroes on the front line who can't work because they have long COVID. I urge the government to commit to recognising long COVID as an occupational disease and to create a scheme to help those people. And this is my most urgent and immediate ask of the Minister in today's debate. So I end once again by thanking all members for speaking today, but above all, everyone else who shared their story. I want them to know that they have not been forgotten, that this House has heard them and it's listening. And our hope is now that the government will step up and act too. Thank you.
The question is that this House has considered long COVID. Dr. Dan Poulter.
Thank you, Madam Deputy Speaker. I'd like to first of all draw the House's attention to my declaration of members' interests as a practicing NHS doctor who's been working on the front line of the NHS throughout the COVID pandemic. There's no doubt, Madam Deputy Speaker, that long COVID has a life-changing impact on the lives of some of the people that it affects. Young people who we often don't hear much of when we discuss the impact of COVID on our hospitals, and we often don't discuss young people when we talk about death rates, which in an illness that predominantly seems to have adverse immediate physical health outcomes for older people. It is young people who very often are the victims of these life-changing impacts of long COVID. It is, as my honourable friend, the member for Abingdon and Oxford West outlined, a subject about which we are learning more literally by the day, and we still need to better evaluate the data and the statistics on long COVID. But undoubtedly, we are seeing a group of individuals who are experiencing effects of COVID often many weeks or months after their initial infection. And it's those individuals who need help. Now, whilst we can welcome the fact that the NHS has set up a new care pathway and new long COVID treatment centres, there are some specific asks which I also have of the Minister. Firstly, that we do need that national register and better data. The COVID app, which has been set up by King's College London and Professor Tim Spector, is an excellent start at beginning to get some national level data on people who have COVID symptoms, people who have positive antibodies for COVID, and indeed it will give us data about the effectiveness of the vaccine. But the key point that we need to take away from that is it's without that we need that data to better understand the impacts of long COVID and to treat people more effectively. My second key ask in the time I have available to me is to look at the impact of long COVID on people with the mental health impact of long COVID on people. We have a cohort of people who are leaving intensive care, who have often been traumatized with PTSD type symptoms in intensive care whilst they're being treated for COVID, many of whom it will take many weeks and months to recover. That group needs special attention in particular. I look forward to hearing from my honourable friend in replying to the debate and welcome other contributions today.
We now go to Ian Lavery.
Thank you, Madam Deputy Speaker. These are very worrying times indeed. I'm worried as a Member of Parliament, and people out there are extremely frightened at what's happening in this country at this moment in time. We saw 1,564 recorded deaths only yesterday, a record. People are worried about what's happening and what the challenges ahead might present. And this includes a challenge of long COVID, which as we begin to learn more about and we gather more information, it appears to pose what can only be described as a serious threat, perhaps more than what we once believed, and one that many people are really still unaware of. And the impacts of this long COVID can be absolutely devastating. And in the most serious instances, totally debilitating for extended periods of time. The symptoms include fatigue, breathlessness, anxiety, depression, palpitation, chest pains, joint or muscle pain, not being able to think straight or focus like it's described as brain fog, as well as many others which have been described earlier. And there's a number of my constituents have been in touch with regard to the experiences they have had with long COVID. And one example, a 29-year-old man has been feeling the effects since way back in February. And after numerous visits to the doctors and several false diagnoses, he was finally told he had long COVID. Another is a 26-year-old woman who, as a result of long COVID, ended up having emergency bladder surgery, consequently developing a neurological disorder, which has left her unable to mobilise without the use of a wheelchair since November. Both were young, otherwise healthy, and worked in the care sector. And as a result of having long COVID, have been unable to earn a proper income and no signs of making any speedy recovery. You know, there's a failure of the social security system to recognise people suffering from long COVID. There should be financial support for those who are unable to work, which includes a review of the poultry and meat, SSP, also the universal credit, potential reduction of the £20. We need to look after people who have got this debilitating disease. And I fear that since the government have failed to successfully tackle any other facet of this pandemic with any degree of confidence, that they'll manage to fail in this as well. Madam Deputy Speaker, I'll conclude by pleading with the government to learn from their mistakes going forward in order to save the lives and get the country back to some form of normality. Thank you.
Number 4 is withdrawn, so we go to Carol Monaghan.
Thank you, Madam Deputy Speaker, and I'd like to congratulate the member for Oxford West and Abingdon for securing this afternoon's debate. For the past 3 years, I've been involved in individuals living with ME, a post-viral condition triggered by virus such as flu or in some cases SARS. Our knowledge of post-viral conditions, particularly with regards to activity management, is essential for the many people who are now living with long COVID. As early as January last year, some people raised concerns that this mysterious new coronavirus could produce similar post-viral effects in those affected. However, the sheer numbers affected by long COVID is a serious health challenge. In addition to listening to, crucially believing, and supporting people with long COVID, health professionals should be providing guidance on symptom management. I'm pleased to see that NICE moved quickly to provide guidelines for long COVID and thankfully has cautioned against the use of graded exercise therapy. But it's surprising to find a guideline recommending exercise testing. Exercise testing in people who may have an undetected cardiac pathology clearly carries a risk. In addition, the NICE guideline contains no specific guidance on the management of any of the common symptoms of long COVID. This is a serious omission and requires urgent attention. Advice on symptom management cannot be left to charities and support groups. Instead, we should be looking at how this can be delivered in primary care with the help of, for example, properly trained community physiotherapists. The need for health professionals, employers, and wider society to recognise that recovery from a virus takes time. Employers must identify tasks that individuals can continue to carry out, and this might be in a different setting to what they're used to doing. The government must ensure that there's proper financial support for those affected. It may be that these people will take months, or it could even be years until they start seeing improvements in their health. And we must make sure that the support system is able to be just that during these times. Today we heard a study by Public Health England that shows that those who have had COVID will have immunity for about 5 months post-infection. Therefore, those who are living with post-viral conditions such as long COVID or indeed ME should be considered vulnerable beyond the 5 months and prioritised for vaccine. Finally, it has taken decades of campaigning, largely due to the lack of belief.
I'm afraid I do have to ask the Honourable Lady, thank her for her speech, but we do need to move on because not everybody is going to be able to get into this debate. So we now go to Marco Longhi.
Thank you. Thank you, Madam Deputy Speaker. I wish to concentrate my remarks in this debate on two things, and hopefully these will show that even though long COVID isn't as high in word search functions, the government and the NHS have not ignored it. So my first observation is that in the context of COVID-19 itself still being a relatively new disease, the existence of long COVID has been known for even less time. And here I must say how impressed I am by the response of government and NHS to put in place a comprehensive 5-point plan for long COVID support with an investment of £10 million in post-COVID assessment services, currently spanning 69 trusts, almost half of all NHS hospitals in the UK. Secondly, Madam Deputy Speaker, I want to provide some real-time feedback from Russell's Hall Hospital in Dudley North. So as my local hospital, they are actually one of the appointed assessment centres. And they inform me today that they have assessed over 500 patients to date. They are working closely with primary and community care colleagues and have produced a stratified multi-professional offering for patients at about the four main aspects of long COVID based on clinical severity and need. Informed that patients with ongoing respiratory symptoms have access to imaging and respiratory nurse and clinician support, and that patients with other organ dysfunction are seen by the appropriate specialists, as are patients with musculoskeletal problems. Long COVID patients can also benefit by the excellent Our Action Heart Service, which is providing state-of-the-art exercise rehabilitation, which already offers an excellent service to Dudley people. And patients requiring mental health support have full access to IAPT, the NHS's improving access to psychological therapies. And finally, Madam Deputy Speaker, there have been a series of workshops with local GPs and the hospital and hospitals to better understand this condition and support services required for ongoing care. So I am also advised, Madam Deputy Speaker, that the CCG is also coordinating work in conjunction with all hospital and CCGs across the Black Country to better understand the wider long-term impact of this condition. And no doubt this will feed through NHS England so that we all have a better understanding of this terrible disease and its legacy. Thank you.
We now go to Tonya Antoniazza.
Thank you, Madam Deputy Speaker. As we all know, long COVID is very real. It's a very real issue that many of our constituents are dealing with. Indeed, we have colleagues and former colleagues from this House that are also suffering from the effects of post-viral symptoms. My friend and former colleague, Jo Platt, has been a great campaigner on this issue, but after 10 months of living with the disease, there seems to have been little progress made. She told me that some of the online support groups that are there have been a lifeline to her, and it's helped to let her be able to find treatment, which in turn has eased some of the symptoms. But this comes with an associated cost, Madam Deputy Speaker, because Jo has told me that her supplement bill is around £90 a month. What happens to those people that can't afford to purchase those supplements? Where is their support? My constituent, Amy Seddon, has also contacted me about her journey. For months, she had no idea what was wrong with her until she found this online support as well. And many of the pieces started to fall into place as they would. Now, Amy has been taking part in the Cover Scan study, through which her own scans show liver changes and potential kidney issues, which could obviously have effect on her life for many years to come. And as an MP and an employer, I have 2 members of my staff battling with the symptoms of long COVID. It is a reality for all of us. One of the most difficult problems is that people are experiencing so diverse problems, and for some, it's breathlessness, it's joint pain, it's anxiety, or all of these together. But we do not, but we do know for all of those people that are affected by long COVID, extreme fatigue is the biggest problem. And many GPs aren't universally aware of the symptoms and are playing catch up with long COVID. I understand the huge pressures that have been put on the NHS and the Department of Health, but there is some short-sightedness here with the government in dealing with this, and it is unacceptable. And it is not just a further strain on our health service, the economic impact of people who would potentially be suffering with chronic conditions for years needs to be managed, and it needs to be managed in a sustainable way. It's also a concern raised by my honourable friend, the member for Feltham and Heston, who isn't able to join us today. She has heard from many of her constituents suffering, like Sam, a care worker, who is unable to work because of this debilitating condition and the pain that she is in. But people going back to work when they aren't ready and have to take further sick days has an impact on their long-term prospects, and that isn't fair on anyone. We need strong leadership from the UK government and from the devolved administrations to deal with long COVID.
Loader.
Thank you, Madam Deputy Speaker. I'd first of all like to commend the member for Oxford Weston and Abingdon on bringing this debate to the floor of the House today. I think it's much needed, and I'm very pleased to be able to contribute in this debate on behalf of my constituents of West Dorset. I'd also like to pay tribute to the NHS and to the government for the work it's doing with long COVID. I was delighted to receive the briefing from the NHS on the 5-point plan on long COVID this morning. But I think this debate is shining a light on a matter that is not fully recognised and is not fully appreciated. The focus of our national effort, understandably, has been about stemming the virus, and particularly with the new strain. But amidst the headlines of daily cases and the deaths and NHS capacity and, of course, vaccinations, we are forgetting, I fear, those who suffer from COVID, who survive it, but who do not fully recover. If you forgive me, I would like to keep going. But those whose immediate threat to life from the more common symptoms has subsided, but who are left with one of the many debilitating conditions that relate and then go on to form long COVID. I'd just like to briefly share with the House some really shocking statistics that I found in my research over the last day or so. 21% of those who get COVID suffer with it for 5 weeks or more. 186,000 suffered with it for between 5 and 12 weeks. And there's bound to be more, because that was a statistic quoted from November last year. 1 in 10 of all those who get COVID suffer from it for longer than 12 weeks as well. But today, I particularly want to speak in support of children and those who care for them with long COVID. Sammy McFarlane is a constituent of mine in West Dorset, and I want to pay particular tribute to her and her colleagues who have set up Long COVID Kids, a support group for children and their parents who are contending with some of the most difficult of long COVID situations. The inspiration of this movement came after Sammy and her daughter caught COVID in March, and both went on to struggle with long COVID. Long COVID Kids has highlighted some very profound realities that we've talked about so far in this debate. But I would just like to conclude my remarks with some clear and decisive asks of the Minister. Children must be counted in long COVID cases, and I fear they're not so far. Paediatric provision is needed in the long COVID clinics. We need to raise awareness of long COVID in schools, and I feel we need a plan and consideration of return to school for long COVID children and avoid fines for parents, but also for appropriately phasing the return of children who are recovering.
We now go to Andrew Gwynn.
Thank you. I want to begin by thanking the Honourable Member for Oxford West and Abingdon for the superb way she opened this debate and for her leadership of the all-party group. My own experience with COVID began in early March when I began to feel grotty and run down. I just wanted to rest, and I phoned the NHS 111 as a precaution. They suggested it couldn't possibly be COVID because there had been no reported cases in M34, even though I explained to them I worked in hotspot SW1. It did eventually develop into typical COVID symptoms, and so I spent the next fortnight in self-isolation. The illness lasted for about 12 days, by which time the country was in lockdown 1. But the reality is that whilst the coronavirus passed, the effects are still with me today. Thankfully, research is now being carried out and government recognises long COVID as being real. That has been a battle. Now, I was lucky. My GP is brilliant and from an early stage recognised my condition long before it had the name long COVID. My condition is not as severe as it was even just a few months back. There have been real improvements, but it's been a hard slog to get here. For the first 7 months or so, the exhaustion came back frequently, and to the point where just doing simple tasks around the house brought me out in massive sweats like I'd run the London Marathon. I had lots of dizzy spells. I've never had vertigo before this. And oh, the brain fog. In a job where you have to be razor sharp, my short-term memory is shot to pieces. I've had to learn to pace myself. Trying to push my limits would set me back. I still have to remind myself not to overdo it. Now the lasting symptom is still the brain fog. When it's bad, taking in information and processing it is so difficult and physically and mentally tiring, often triggering headaches, dizziness and vertigo. I'm fortunate in how I've been able to balance work with my disabilities. Virtual participation and proxy votes has helped. I talk about the difficulties of me doing my job, but what about the mechanic, the builder, the emergency worker, the teacher, the nurse, people who don't have the luxury of virtual participation, aid memoirs and an efficient and brilliant office to hide deficiencies? They're left to struggle, make the most of it or lose their jobs. And on the latter point, the DWP has to do more to recognise the condition for work capability assessments and other interviews. Now, I'm so grateful to some of the representatives from long COVID support groups for meeting with me earlier this week. They want government to acknowledge that children can also get long COVID. Of course, children often present with different symptoms to adults, and so an awareness campaign is required. But children should also have access to treatment within long COVID clinics and throughout the NHS. In closing, look, this problem of long COVID isn't going away. It's growing as the number of people catching COVID grows. I'd like to hear from the Minister a holistic approach on research, treatment and support in the health sense, but also in the well-being sense, the workplace sense and the family sense too. Let's support people and their families better.
Thank the honourable gentleman for his speech. Dean Russell.
Thank you, Madam Deputy Speaker. I have to pay tribute, and pleased to pay tribute to the member for Oxford West and Abingdon for calling this debate today. I think it's such an important topic to be speaking about. And I think over the past year, especially as a member of the Health and Social Care Select Committee, we've heard lots of evidence from lots of areas of the NHS, from social care, from patients, from staff, around the challenges they've stood up to face in the face of COVID and the issues that has raised. And what I've seen throughout the year is a constant change of the landscape, a constant change of the battles we're having to fight, and a constant relearning of what we thought we knew about this terrible virus. And long COVID is part of that ongoing story about how do we challenge ourselves to continually learn and continually fight the challenges that it's going to be bringing towards us. And I think when we look at long COVID, the government and the NHS must be thanked in many ways for the work that they've done, setting up 60 specialist centres, getting the 5-point plan put in place. But of course, there's always more to do. And I think the repercussions of coronavirus are not going to be with us until we get all vaccinated. It won't just be with us until we all deal with this over the next few years and start to get back together again. It will be with us for years. There are unknowns that we will not know until we face them in the future. Long COVID is one of those challenges that we will be facing and learning more about as the months go on and, sadly, as the years go on. In a similar way that we're facing challenges now around mental health, which we're learning more about not just ourselves, but about society and about how we support each other. I have to pay tribute to my right honourable friend, the Minister for Mental Health, for the incredible work that they're doing and she's doing to tackle the challenges around mental health and in this area. But what I say to everybody out there is let's work together on this. We have to make sure that we're sharing the stories of the challenges we're facing, because we don't yet know whether some of the challenges we might be facing in our own health might be due to COVID. It might be due to long COVID. It might be affecting our family in ways that they may not be sharing those stories. So let's make sure, as a message from this excellent debate today, from all the wonderful words that have been spoken, that we learn from this. And my message to anybody out there, including members in this chamber, is please share the challenges you're facing. Speak to your GP, speak to your family, share those stories, because you might be one of many silent people out there that when you combine together have a voice that's so much greater than you on your own and can save lives and change lives as we move into the future. So thank you, Madam Deputy Speaker.
We now go to Debbie Abrahams.
Thank you, Madam Deputy Speaker, and I also would like to pass on my congratulations to the member for Oxford West and Abingdon for securing this very important debate. Madam Deputy Speaker, it's probably understandable that in the middle of the COVID pandemic, the focus has been on primary prevention and managing the symptoms of those who've become infected. But given, as has already been said, that the COVID tracker survey suggests that more than 4 million people, that's about 12% of the population, have symptoms beyond the 4-week acute phase, with 1 in 10 with symptoms beyond 12 weeks. We also need to develop healthcare management responses that recognise COVID can have effects way beyond the acute phase, which typically lasts just 4 weeks. On top of that, we also need to have an appropriate societal response to long COVID, where people are supported during their illness and don't feel stigmatised. I think that's incredibly important. I'm pleased at the speed with which NICE have brought forward their guidelines for managing long COVID. I particularly like the recommended holistic healthcare approach when assessing a patient with symptoms between 4 and 12 weeks, and also after 12 weeks, with the emphasis of empathy and acknowledging the impact the symptoms may be having on the patient's day-to-day lives, including their ability to work. However, I was surprised that there was no reference to immunology or immune therapies. I hope that we have learned from the mistakes made in how we prevent, treat and care for people suffering with chronic fatigue syndrome, also known as ME, as well as post-viral syndrome. We know that COVID-19, like other viruses, attacks multiple systems: respiratory, cardiovascular, nervous and gastrointestinal, as it attaches to epithelial cells which are distributed throughout the body. But our body's ability to fight the virus depends on our immune systems reacting appropriately and not overreacting. The British Society for Immunology and a number of other researchers have suggested that in addition to long-term damage to multiple organs, the pain, muscle weakness, fatigue, and even brain fog often associated with long COVID may be due to inflammatory issues associated with our immune system itself rather than COVID. Madam Deputy Speaker, there is still so much we don't know about the virus, and I absolutely support the calls for more research into this, as well as a disease register established. As mentioned, more research is needed, and I'm a strong advocate of evidence-based medicine, but it's important that we never let the perfect be the enemy of the good. Finally, Madam Deputy Speaker, we must make sure that, as I mentioned before, it is a societal response, not just a healthcare response. Working age people in particular must be supported by their employers and the government through DWP. We must ensure adequate support is provided to those with long COVID who aren't able to work. Stigmatising those with long COVID should not be tolerated. Thank you, Madam.
Jo Gideon.
Thank you, Madam Deputy Speaker. The coronavirus pandemic has shed light on some of the inequalities that exist within our society. The evidence shows that those who've been worst affected by the virus are generally those who had worse health outcomes before the pandemic, including people from less affluent communities like Stoke-on-Trent Central. Government advisor and Professor of Immunology, Professor Altman, was very clear in his remarks to the all-party parliamentary group on coronavirus that while there is relatively little consensus in the clinical world regarding the causes and treatment of long COVID, There is a shared understanding amongst medical professionals that long COVID can affect anyone and everyone in society, including those who are young, fit and healthy. However, we know that the body's ability to recover is better if a person's general health is strong. So it is vital that we do everything we can to reduce health inequalities, so that constituencies like Stoke-on-Trent Central are not disproportionately affected by the consequences of coronavirus and the impacts of long COVID. Tackling obesity must be placed at the very top of our political agenda. We know that people who are obese are far more likely to become seriously ill and to go into intensive care if they contract the virus. I believe food labelling needs to be reformed so that we can have an emphasis placed on promoting healthy foods, not simply junk food that is bad for you but meets food safety standards. The current bewildering myriad of statutory food labelling requirements from 9 different agencies does not make it easy for the consumer. We know the benefits of clean air and exercise for our physical and mental health. A recent report in The Lancet highlights a very real problem. Reduced movement behaviours amongst children and young adults caused by COVID-19 restrictions, if not adequately addressed, will have serious ramifications for long-term health outcomes. So I welcome the recent proposal in the Centre for Social Justice report to extend the school day for years 7 to 11 by 2 hours for sport and physical activities. One of the many symptoms reported by people suffering from long COVID is something similar to a brain fog. This causes a lack of mental clarity, an inability to focus and poor concentration levels. And it was very eloquently described by the Honourable Member for Denton and Redditch. I know that the government is absolutely committed to investing in mental health services, including in my constituency, a record £15 million to fund acute and community mental health services. Many people suffering from the brain fog find respite by taking in fresh air and light exercise in green spaces and good air quality. And so I am particularly keen to see more access in my constituency to the River Trent and to support environmental health projects. To conclude, there is one thing that we have learned from this pandemic, and it must be that the health of our nation is a collective responsibility and impacts each and every one of us. From our economy to our environment and the health of our communities, it is absolutely integral that we look after each other and our communities for our nation's long-term recovery and our ability to build back stronger.
We now go to Wayne David.
Thank you, Madam Deputy Speaker. And could I say that I'm really pleased that this important debate is taking place today. We're all, of course, aware of the huge strain on the National Health Service caused by acute COVID-19. But I strongly believe we must place an emphasis too on the treatment and support of long COVID sufferers. Too often, these patients feel forgotten. Now, on Tuesday, I participated in a briefing session organised by the member for Oxford West and Abingdon and the APPG on coronavirus. This was an excellent session, and we heard some really moving statements by people who are suffering from long COVID. But I want to refer this afternoon to two local cases in my own constituency of Caerphilly. The first relates to Mr. Lee David Bowen from Two Thomas. Lee is a first-rate opera singer. He's a tenor. But back in February of last year, he had a slight cough, at first feeling a bit chesty. His doctor examined him and said it was either a virus or reflux. A few days later, in February, Lee felt extremely exhausted, could not focus and had no energy. His situation further deteriorated, and at the beginning of March, he felt really hot and felt as if he had the flu. So he went home and isolated, but the symptoms then got worse, him becoming ill with sore throat, and chesty cough, aches and endless fatigue. The situation since then has not got better. Only this morning, Lee contacted me to say that 10 months later, he still was suffering from fatigue, and he'd had a few days which were very bad indeed. The second case I'd like to refer to is of Maxine Simmons. Maxine is a hospital radiographer at the Lindra Hospital in Cardiff. And she told me, and I quote her exactly, Just a few weeks ago, she said, "I have been suffering seriously ill with confirmed COVID-19 and had some help from my GP, but urgently required help from the respiratory team for a CT to assess risk from blood clots and assess lung damage from both COVID-19 and pneumonia. I've also been referred to cardiology, but await to get even a referral to essential neurology." Her situation is getting worse, she says, and she's no longer able to work. And I would like to say these two cases are not isolated examples. I could refer, as members could also, to many other examples. And I would hope that we pay much more attention to long COVID and we allocate the resources to make sure that this situation is dealt with and dealt with quickly.
We now go to Claire Hanna.
Thank you very much, Madam Deputy Speaker, and indeed I thank the member from Oxford for bringing this debate, which will bring at least some comfort to some of those who will be dealing with the effects of long COVID and doing so in isolation without access to some of the NHS supports that we hope that they will be able to access in future. We know so much more now about this disease than we did at the beginning of the pandemic, including the fact that it isn't just respiratory disease. It can certainly be a multi-system disease, and that makes it even more regrettable that we still have some who persist with the narrative that falsely that COVID only affects the vulnerable. And we know that not only is that dehumanizing and dismissive of older people and those with long-term conditions, but it is also false, because we know and we are seeing the statistics coming through of many people who were previously younger and fitter and healthier who are now experiencing these lingering symptoms over a month after the acute phase of their illness. Members have outlined many of those symptoms, and we are seeing research from other countries as well about the lingering impacts, and indeed how these compare with previous SARS epidemics. Members have also laid out some of the necessary courses of action around guidance and around ongoing research, so that those who are experiencing long COVID can have access to a pathway, because currently, certainly in Northern Ireland, in the absence of formal definitions, there isn't recording and therefore there won't be tracking of those affected, and extrapolating from the wider numbers of those who've contracted COVID. We can anticipate that there are around 9,000 people in Northern Ireland who may be experiencing long COVID, and that is in the context of already horrendously long waiting lists for the NHS. For example, we already have 20,000 people waiting for a first neurology appointment, and people seeking long-term care will be added to these lists. The key point, therefore, members, is that an adequately funded NHS and an adequately staffed NHS is the key to caring for these individuals. And others in the long term. Years of underfunding has been laid bare as the NHS struggles to cope with the peaks of the pandemic. We owe it to those who have contracted COVID. We owe it to those who are living with long COVID and indeed other long-term conditions. And crucially, we owe it to the staff of the NHS to ensure that it is never again left in such a perilous state.
Mr. Carmichael.
Thank you very much, Madam Deputy Speaker. And can I first of all congratulate and thank my honourable friend, the member for Oxford West and Abingdon, for having applied for and secured this debate, and also for setting up an all-party group on COVID, something which is so important in terms of giving this House a voice in relation to the detailed response to the issues that have been thrown up by the COVID pandemic. I think the one point that I really want to get across in the short time that is available to me is that so little is yet known about long COVID. We have an emerging picture, and that is a picture where we as in government, or those who are in government rather, have to demonstrate a bit of humility in terms of the response, to accept that we don't yet know the full picture of how this will accept people, and that there must be more flexibility in the way in which the system responds to people who are affected in this way. The point has been made to me by constituents that there's a lot of crossover between the symptoms and the treatment of people with long COVID and those who have suffered from ME. I think the point was made by the Honourable Lady from Oldham East and Saddleworth. And certainly, if I look over the years of the way in which the benefit system has coped with people who are suffering from ME, let alone the medical profession, then you can see that this is going to be a problem with which we shall have to be coming to terms for some considerable time. I just want to share with the House one email I received from a constituent which illustrates very well, in fact, I think, the way in which people unfortunately are so often left to fall between the gaps. This is a constituent who had 2 part-time jobs. She worked as a tourist guide and she had another job 2 days a week. She wrote to me, because of the 50-50 rule, I wasn't eligible for SEISS. So when I was made redundant at the end of my furlough, I sent my P45 in, hoping for job seekers allowance. I've just had a phone call to say that I'm ineligible for JSA as my Class 2 contributions as a self-employed person don't count, and I wasn't making Class 1 contributions for long enough. I pointed out that I'd paid Class 1 contributions in tax for over 40 years. She apologised and said that's only the last 2 years that count. I'm ineligible for universal credit due to my husband's pension. He's 77. That means I will have to take out my minimal work pensions. The total one in one pot is about £65 in order to survive until my state pension kicks in 13 months. That, I'm afraid, shows the way in which too many people have been left behind and excluded from the provision that the government have brought in. I just say in conclusion, things could have been so different if only the government had been prepared to listen to those of us who said right at the start that there would be a role for a universal basic income in meeting this challenge for our society.
Barbara Keeley.
Thank you, Madam Deputy Speaker. I want to thank my honourable friend, the member for Denton and Redditch, and the honourable members for Oxford West and for Central Suffolk for securing this debate, and the Backbench Business Committee for scheduling it in the Chamber so that all MPs can take part. This is an important and timely debate as we pass the grim milestone of 100,000 COVID-19 deaths and well over 3 million confirmed cases. We should remember each of those 100,000 deaths as the human tragedy it was, as well as a sign of the failure to control the virus. Together with colleagues in this debate, I have heard evidence of the impact of long COVID from witnesses to the All-Party Parliamentary Group on coronavirus. The impact on their lives is profound and their numbers are growing rapidly. It's important that we recognise that COVID-19 is not binary, with people either dying or recovering fully. The truth is that we still have little idea how COVID-19 affects those who survive it in the longer term. Even people who started with mild COVID symptoms may end up suffering noticeable effects and developing new or worse symptoms for months. Of the many issues raised by the witnesses with long COVID at the APPG, an important issue is where they contracted the disease. Our witnesses this week all worked in the NHS, and we heard that the doctors' long COVID group is expanding rapidly. It is right to question whether the conditions of work on the front line might mean that long COVID is more prevalent among those who acquired it at work. Given the devastating impact of long COVID, we need to establish whether it is an occupationally acquired disease. If it is, it should be reported on, monitored and protected against as any other workplace acquired disease would be. So can the Minister set out what they're doing to require employers, including the NHS, to monitor long COVID among their staff, and what steps will be taken to support frontline staff with long COVID? As I have said, COVID is not a binary disease. It is simply not the case that you either die from it or recover fully. We must remember every COVID death as the tragedy that it is, but we must also start to fully acknowledge and deal with the long-term impacts that this disease can have. People are living with the effects of this virus for months and maybe even years, and they need our support. They need a health system which can identify long COVID and research so that we can begin to treat it effectively. They need financial support if they cannot work and to establish whether long COVID is an occupationally acquired disease. And we need a COVID strategy which goes beyond preventing deaths. We need to drive cases down even when the most vulnerable are vaccinated, so we do not create a new generation of people living with long-term health conditions. And I believe we particularly need to establish COVID-19 as an occupational disease and support the frontline staff with long COVID who cannot work because of their symptoms. It must not be forgotten.
We now move to, I'm afraid, our last backbench speaker, Janet Davey.
Thank you, Madam Deputy Speaker. I would like to thank the Honourable Member for Oxford West and Abington for arranging this important debate today. I hope that today's debate will raise awareness of the issue, cause the government to reassess the rate of sickness benefit and invest in research. Long COVID can affect anyone who is caught the virus. It is another one of those invisible illnesses that people cannot see and many do not know it still exists. Constituents, friends and family have reached out to tell me of their physical and mental struggles with long COVID. Persistent breathing problems, coughing, fatigue, dizziness, chest pains, insomnia are some of those that have been mentioned to me. Even getting a diagnosis has been challenging, of having to go through all manners of scans and tests. Lack of explanations and solutions has led to support groups being created online where people with long COVID can connect with one another and share their difficulties. But not everyone has online access and not everyone is able to communicate their experiences. Low public awareness of long COVID leaves sufferers feeling even more isolated. I'd be grateful to hear from the government how they will raise this profile of this illness. NHS is desperate to help these patients, but they need help from the government to do this. The government needs to ring-fence funding for research into the illnesses and find treatments. People with long COVID also often find their ability to work seriously affected. The economy suffers from this section of the workforce being incapacitated. Sick pay is £95.85 per week. And my constituents' rent in a shared home is £900 with bills. Each month they're short of over £500 per month, and their situation is not dissimilar to others, which means the sickness pay rate is inadequate. Another constituent tells me, how much longer is our society going to keep treating people with illness as a burden? How long are people going to face such hard decisions just to keep living? Although I can't give my constituent all the answers they need, I, along with colleagues today, call on the government to recognise this illness, commit to reassessing the sick pay rate and to fund research treatments to cure and to help sufferers with long COVID.
Thank you. And I do realise there have been a number of colleagues who haven't been able to get into this debate. As I've said, we have had a very short time for it. The front benchers have agreed to speak for less time than they normally would do. And I now go to the SNP spokesperson, Neil Hanvey.
Thank you, Madam Deputy Speaker. I commend the member for Oxford West and Abingdon for securing this very important debate. Long COVID is a prevalent and growing concern, which is every bit as important as community transmission rates, excess mortality rates, and the consequential impacts on other life-saving services such as cancer services. It's evident in my Kirkcaldy and Cowdenbeath constituency, Bailey Lee Robb, who is an 18-year-old student from Logelly, he tested positive in October. He was isolated originally in his university accommodation, but he has now returned home to recuperate. He told me, due to long COVID, I'm on painkillers as I have a bad lower back and knee pain. I still have a loss of smell, shortness of breath, short-term memory loss, insomnia, and some of my body randomly breaks out in rashes. While I try to lead a normal life, some days I can't leave bed because I'm that sore and exhausted. It's horrible. He felt the impact on young people is important. Even if fewer young people are dying from COVID-19, long COVID could be with them for a lifetime. There is a pressing need for governments to raise public awareness of long COVID and to urge lockdown compliance and limit community transmission. Research suggests that 10% of the infected population will suffer from long COVID, and in line with other post-viral syndromes like ME, may become a chronically, potentially lifelong condition. The president of the British Society for Immunology has said, as the pandemic has gone on, it has become clear that COVID-19 is more far-reaching than affecting just the respiratory system. Going on to note that this insult may be a consequence of generalized systemic inflammatory response mediated by the body's cytokine storm against COVID. Shortness of breath can lead to pulmonary fibrosis, circulatory, cardiovascular, renal, neurological and mental health impacts, and very real survivorship challenges, including depression and suicidal thoughts. The British Heart Foundation, the British Lung Foundation and others also recognise the role inflammation plays in the disease progression. Anyone who works in ITU knew long before COVID that such a systemic inflammatory response can lead to multi-organ failure and death. Madam Deputy Speaker, long COVID is real, also affecting young people like Bailey Lee. There is limited empirical evidence on how to diagnose, support, treat and rehabilitate sufferers. In Scotland, we advocate a holistic approach based on the organisation of services, and we are currently considering this at present. Over 70,000 Scots will be provided with free vitamin D. This is recognised as having a role in the prevention and the moderation of morbidity. And this week, the Food Standards Agency in Scotland launched a vitamin D campaign for the general public. The Scottish Chief Scientist Office recently concluded research calls into the long-term effects of COVID-19, with funding totaling £2.5 million being recommended for 9 projects across Scottish universities. In addition to this funding, the Scottish Government are supporting an ongoing study on the longer-term lung health of COVID-19 related acute respiratory distress syndrome and supporting Scottish participation in the UK-wide post-hospitalisation COVID-19 study. Of course, it's also key to listen to those living through the condition, such as Long COVID Scotland and the Post-COVID Syndrome Support Group. And this is vital to improve understanding of the longer-term effects and develop effective clinical interventions to support recovery and rehabilitation. In that regard, PCS founder Louise Barnes has called for a shift to effective treatment after she made contact with a clinical team in South Africa regarding a peer-reviewed study looking at the use of a 6-vitamin stack protocol. And despite being sceptical, Louise felt she had nothing to lose, so participated in the trial. Within 3 days, she saw notable improvement. I felt in days almost back to normal, she said. This study is promising as we know the valuable role vitamin micronutrients can play from treating leukemia. Of course, 6-vitamin stack is not going to suit Big Pharma unless they develop an analogue of the vitamin that they can patent. I've not looked into the detail of this study, but it is very positive and deserves serious consideration. So, Madam Deputy Speaker, what is the UK government strategy? It's clear we must take action now. We must properly record, research and develop means to defeat the mechanisms of long COVID. Otherwise, we are creating further resource and financial burdens for the NHS well into the future. Will the UK government develop appropriate additional support and funding for the NHS to meet these challenges, however they are to be delivered? And will the government now accept the pressing need for continuation of the £20 universal credit uplift and its extension to legacy benefits in light of long COVID? We also need action on sick pay rates. The UK has one of the lowest sick pay rates in the OECD. The SNP has continuously called on the UK government to increase SSP in line with the real living wage. It's a disgrace that the UK government's meagre £95.85 rate of SSP is poverty pay by comparison to the rate in Ireland of £266 and other countries such as Germany and Austria, where it is over £280. Long-term meaningful economic support must be put in place for long COVID sufferers. So will the UK government immediately increase SSP so that long COVID sufferers have financial support? And most importantly, and in conclusion, will the UK government match the Scottish Government's ambition and fund research into post-COVID syndrome, allowing sufferers hope that their new normal is not post-COVID syndrome or long COVID? Thank you.
Minister, Dr. Rosanna Allen-Carr.
Thank you very much, Madam Deputy Speaker. And I would like to begin by thanking the honourable members for Oxford West, my friend the honourable member for Denton and Reddish and the member for Central Suffolk and North Ipswich for securing today's debate. And I'd like to thank everybody for their very personal contributions today. For thousands, COVID-19 is neither something succumbed to or overcome in a matter of days. For many, it has lasting mental and physical impacts which affects the body many, many months after initial infection, and nearly a year since the first case of coronavirus was recorded in the UK, and still very little is known about the debilitating post-COVID syndrome. I would like to pay tribute to the Long COVID SOS group and all of the online support groups who work tirelessly to raise this issue and to support one another. At this stage, we cannot say with any real certainty what exactly Long COVID is, nor can we accurately predict the true number of people suffering symptoms of Long COVID. The ONS has published estimations suggesting that the proportion of people displaying symptoms for a period of over 12 weeks could be as many as 1 in 10. Let's be clear, this is not a syndrome being experienced by a small minority of people. There is also finite evidence on the best way to treat the condition, which has vastly varied symptoms. And without a clear understanding of exactly what the condition is, it makes it far more difficult for health professionals to manage and support those that are so affected by it. With better data collection, further research, and by listening to those living with long COVID, we can begin to effectively treat this condition. Can the Minister please outline what work the government is doing to close this gap in knowledge? What we do know for certain are that the symptoms of long COVID can be severe, completely debilitating, utterly crippling, and preventing people from living their normal lives. This impact can have a detrimental effect on people's mental health, their well-being, as well as what we've heard today, their physical well-being. It leaves many unable to return to work months after their initial battle with the virus and causes a great deal of uncertainty on already anxious minds. This is crucial to understand, as stress and anxiety can cause relapses in the condition, as sufferers themselves have told me. And many people with long COVID don't know when or if they'll return to work. Without action from the government, the long-term social and economic consequences of this could be grave. Key workers have an increased risk of catching COVID. NHS workers in particular are at least 3 times more likely to contract it than the general population, and this could wreak havoc on our frontline workforce. What steps are the government taking to not only protect the NHS workforce further, but to ensure that staffing levels are such that patients continue to be treated and the population continues to be vaccinated? Madam Deputy Speaker, the availability of treatment and care for individuals experiencing long COVID must be of immediate concern to the government. I urge the government for a patient-led approach. Could the Minister please outline what progress has been made on setting up long COVID clinics, and what plans does the government have to extend this programme in 2021? There simply cannot be a postcode lottery of service provision for long COVID sufferers. No one person's life is more valuable than another, and the government must ensure that this is reflected in access to treatment. Some long COVID patients are being denied referral because they never had a positive COVID test, and for the many people who suffered with COVID in the first wave back in March and April and were not eligible for testing at the time, this is proving incredibly frustrating. Will the Minister outline what measures the government will take to ensure people do not miss out on much-needed treatment, particularly if they fall into the category of people that weren't able to have a COVID test in the first wave? The government has to step up and show leadership. There has to be clear messaging to the public, ensuring that they are sufficiently informed about this condition and where to seek help if indeed they need it. This messaging needs to combat the misinformation that is out there about COVID, that presents it as a myth and similar to the flu. I would like to pay tribute to the former MP for Lee, Joe Platt, who along with Long COVID SOS and support groups on Facebook is campaigning tirelessly on this issue. Joe told me, there is no word to describe how COVID deniers have made her feel. For people to seriously deny your experiences, she told me, has been soul-destroying. We have to get this right. It is also essential that healthcare professionals at every level of the NHS are properly trained to treat long COVID, distinguishing between the different conditions which fall under the term. This also includes frontline mental health workers, as the mental health implications of long COVID can be severe. Within an acute crisis, it is far too easy to push longer-term concerns to the periphery. Should the government continue to do so with long COVID, they do so at their own peril. Throughout this crisis, far too many people have felt that their voices have been silenced. For the sake of the health and well-being of all those living with long COVID, please do not silence them. There is still so much unknown about this virus and how it affects us. One thing for certain is that long COVID should be of serious concern, and without concerted action by the government, we may be living with the consequences for this for many years to come. We are still learning so much more about the impact of COVID-19 on our communities, on our bodies, for our well-being. There are thousands of people out there currently suffering with long COVID. They're relying on us, they're relying on the government to get it right for them. Thank you.
Minister Nadine Dorries.
Thank you, Madam Deputy Speaker. I'd like to start by thanking the honourable members who have tabled the debate today to discuss this very important topic. We know that long COVID can have a significant impact on people affected, and I am proud that this government is committed to doing everything we possibly can to support people who are still suffering with the effects on their mental and their physical health. COVID-19 is still a new disease, and indeed my Honourable Lady began her speech by identifying that we still don't actually know. We're so new in the disease pathway of COVID that we still don't have the evidence or the understanding of what it is that fully is long COVID. It is not yet clear what the medical, psychological and rehabilitation needs will be for those experiencing long-term effects of the virus. Typically, the time to recover from COVID-19 is within 10 to 14 days for mild and moderate cases. However, some people may experience lasting impacts on their health. Long COVID describes a mix of mental and physical health effects. Research from the ONS has shown that 1 in 10 people do indeed have COVID-19 symptoms for 12 weeks or longer. And they also estimated in mid-November that around 186,000 people were experiencing symptoms between 5 and 12 weeks post-infection. I would also like to start by giving an update on the important work that the government and the NHS are leading into long COVID. We continue to work closely with the NHS and other stakeholders to develop and deliver high-quality services to patients, to make rapid progress in terms of research and ensuring effective communications and engagement with the public and the workforce. The NHS has launched a 5-point plan for dealing with long COVID and for the support on the 7th of October 2020. And just as they have rapidly stood up specialist care for acutely ill COVID-19 patients at the start of the pandemic, it is now responding sensitively and effectively to long COVID. The nice guidelines for COVID for a long COVID were published on the 18th of December, and how to manage long COVID. For the first time, we have clinical definitions and terms for the initial illness and long COVID at different stages. The guidelines describe the most commonly reported symptoms of acute COVID-19 and long COVID. Acute COVID-19 covers the signs and symptoms for up to 4 weeks. Long COVID or post-COVID syndrome is commonly used to describe the signs and symptoms that continue afterwards after acute COVID-19. The guidelines also set out the support that long COVID patients should receive. The NHS announced Your COVID Recovery online service on the 5th of July. This online tailored rehabilitation programme enables patients to be monitored by their local rehabilitation teams, and Phase 2 was rolled out in November to provide further support for people with long COVID. In October, NHS England announced £10 million to fund a network of assessment service centres in each part of England. These new services bring together doctors, nurses, physiotherapists and occupational therapists to offer both physical and psychological assessments and refer patients to the right pathway of treatment and rehabilitation. My colleague, the Honourable Member for West Suffolk, the Secretary of State for Health and Social Care, spoke to the House in October about his visit to the cutting-edge long COVID clinic at University College London Hospital. There he met people in their 20s and 30s who are living with the long-term effects of the virus, and it has completely changed their lives. There are now 69 centres operating across England where hundreds of patients are already receiving treatment. These centres are assessing and diagnosing people experiencing long-term health effects as a result of COVID-19 infection. A further 12 sites are earmarked to launch in early 2021, and they will be in East Midlands, Lancashire, Cornwall and the Isle of Wight. The NHS and wider scientific community are currently working to better understand the disease, course of the COVID-19 virus, including symptom, severity and duration, long-term effects and how best to support recovery. And NICE and the UK Research for Innovation have invested £8.4 million into post-hospitalisation COVID-19 study at the University of Leicester. This is one of the world's largest comprehensive studies into the long-term health impacts of COVID-19 on hospitalised patients. The study aims to better understand and improve long-term outcomes for survivors following hospitalisation with COVID-19. NIHR and UKRI also announced a joint research funding call for ambitious and comprehensive research into the long-term physical and mental effects of COVID-19 in non-hospitalised patients. The panel are currently reviewing the bids and projects and are expected to commence in early 2021. The NHS has launched a long COVID task force to help lead the NHS response to long COVID, to produce information and support material for patients and healthcare professionals and develop a wider understanding of the condition. Led by the Director of the Primary Care at NHS England, Dr Nikita Kiani, on the long COVID task force, brings together patients, charities, researchers and clinicians and policy makers and the Royal Colleges to provide an advisory function and to support the delivery of the NHS 5-point plan. My colleague, the Noble Lord Bethell, continues to hold monthly long COVID roundtables to provide updates from NHS England and improvements, and others working on various areas of long COVID. The COVID-19 vaccine marks the start of the fight back against the pandemic. The NHS is deploying vaccines right across the UK. We've reached 3 million today, in line with the founding mission to support people according to clinical need, not the ability to pay. Long COVID is a new challenge for healthcare systems all over the world, not just in the UK. The UK is committed to listening to people with long COVID and leading the way on excellent research, treatment and care. I would like to pay tribute to the hard work and dedication of NHS staff to set up these services and so to quickly meet the needs of the sufferers and medical needs all over England, and to the researchers working hard to better understand this issue, and to the people living with long COVID for sharing their insights and their experience with us. Combined with further research and the NHS England Long COVID Task Force and the additional services that we are providing and the additional funding, we hope to improve lives and aid in the fight against this global pandemic.
Layla Moran to wind up.
Thank you, Madam Deputy Speaker. I'd like to start by just saying a thank you to all the members who contributed, but also to all those members who were unable to contribute. When we put in for this debate, we thought it would be well subscribed, and given I would wager most members in this House would have been contacted by a constituent or more than one constituent who can now have long COVID. And I would like to start by saying for all those with long COVID who are watching today, I hope they have the assurance that this House will continue to listen and encourage the government to take action as our understanding of this disease improves. We've certainly heard some powerful stories today, and there won't be time obviously to go through all of them. Struck of course, as we always are, by the contributions from the member for Denton and Reddish, who brings it to life with his own experience, but quite rightly brings up well, what about those who don't have the flexible working that is afforded to us as MPs? I think other contributions to highlight, several members mentioned that there are learnings that we must take from other conditions. In particular, ME was mentioned by the member for Glasgow and other members as well. And I think, and I thank her for her work and leadership on the all-party group on ME. I think there's a lot that we can learn from that. Mental health was rightly raised by the member for Central Suffolk and North Ipswich, and the trauma that people face as a result of being hospitalised with COVID. But almost all members, I think, at some point or other mentioned financial support and the failure of the West welfare system to cope with this changing landscape was highlighted by many. I think that's an area that we need to push on. And the member for Orkney and Shetland, I think, put it very well when he said that government needs to take a humble approach to the changing picture. I would like to thank the front bench spokespeople, and in particular the Minister, for her response and listening so diligently to this debate. I thank her for the update on the research and the NHS response. It is clear that we are finally getting going, but I hope she also recognises we need to continue to finesse and change as our understanding evolves, and I hope she'll take a personal interest. And finally, it would be wonderful if she'd be if she would consider a meeting with me and others in the APPG to talk about the areas she didn't cover, in particular the register and the publishing, and if that's possible, but also the recognition by employers and recognising that long COVID